Family Violence, Chapter 11, Adult Intimate Partner Violence, Practice, Policy, and Prevention. This is a narrated version of this PowerPoint presentation. Issues discussed in your textbook related to abused partners, practice, policy, and prevention, primary women, include agency practices. Isolation of battered mothers is a primarily concern for agency working with battered women. Social support issues. What type of social support help, the type of support provided is crucial. Helpful agency actions include having battered women having more control when working with others, improving shelter services by making sure that a comprehensive abuse history is taken, and screening for substance abuse. Other issues related and discussed by your textbook include admittance policy. Battered women who strike back are not true female batterers, teaching parenting skills because battered women's energy have often been sapped by violence. Parenting classes are necessary for battered mothers. Transitional supportive housing should be expanded to respond to all women to avoid homelessness. Psychotherapist practices. Issues discussed by your textbook include general counseling topics for battered women. Clinical screening should screen clients for male to female IPV, substance abuse, and trauma syndrome. Basic counseling goals should include how clients define the meaning of their partner violence, understanding the causes of it, and the role it plays in their lives. Alcohol treatment to respond to the high number of IPV victims suffering from substance abuse. Remaking victims' belief system is the most important therapeutic work. Dangers in leaving the abusers is a task that a counselor should apprise clients leaving an abusive relationship. Brain-based psychotherapy takes into consideration the brain's role in developing problems, feelings, thoughts, and behaviors, and in modifying them. Individualized treatment is necessary because one size does not fit all. Victims' attachment and grief-positive feelings towards abuser need to be acknowledged as negative feelings. Regulating closeness, important to discuss regulating proximity and distance strategies. Coping style of battered women are strongly related to helping seeking behaviors. Personal empowerment strategies are an essential component of recovery. Forgiveness is a sensitive but necessary subject to discuss and should take into consideration cultural definitions. Other issues. Policy victims should be treated as experts in the areas of policy making. Issues discussed related to discrimination against women. Discrimination against women in political and legal system allows practices to undermine women's attempts at independence. Issues discussed include discrimination against women occurs in many other settings, discrimination in housing, discrimination in the court system, and legal changes. Economic support and freedom from battering discussed in your textbook. Topics include discrimination in the workplace. Policies of corporations need to change to address employees' needs. Shelter economic skills services help meet employment and educational needs. Training unskilled males, and legislators should strengthen existing laws. Victim services. Topics discussed in your textbook include welfare, while helpful, can increase the risk of battering for some women because of regulations. Needed changes in welfare in ways that recipients are screened for intimate partner violence. Greater focus on MFIPV is needed. Misguided welfare programs can affect women negatively. Hiring and training welfare workers is needed because many workers are not aware of identifying domestic violence. Healthcare providers. Topics discussed in your textbook include, since 1991, a number of physical and mental care organizations include a routine IPV screening as part of their medical screening. During 1990s, mandated identification of battered women in the emergency room was initiated. Centers for Disease Control and Prevention, CDC, provides more valuable about domestic violence. Medical professionals need more training in order to be more effective in screening and referring IPV victims. Prevention strategies discussed in your textbook include need to address sexist, patriarchal, and hostile attitudes toward women. College classes are not requiring freshmen to attend violence prevention classes. Public awareness programs may enable potential victims to avoid victimization, and prevent programs offer a relevant model of prevention program using a team approach. Abusive adult partners practice. Issues discussed by your textbook include much of the work with batterers focuses on helping them recognize their abuse. The type of treatment used with batterers has been controversial mainly because of the split between trained licensed mental health practitioners and trained feminist advocates. Examples of different approaches discussed in your textbook include the Duluth model, electric model approaches, and couples therapy, including family therapy and system therapy. Alcohol and drug substance abuse treatment. Practitioners must address alcohol and other drug abuse in the treatment of domestic violence. An integrated substance domestic violence treatment program is the best strategy. Psychiatric, psychotropic medication treatment may be required for batterers who suffer from a form of psychopathology. Treatment effectiveness studies have not provided firm conclusions about the value of specific types of treatment. Challenges in treatment evaluation include methodological deficiencies, including a lack of random assignment and attrition, batters' treatment completion and non-completion. Effectiveness of batter intervention programs are evaluated by the following methods: consumer satisfaction surveys, propensity score analysis, and post-treatment changes among batterers. Abuse adult partners prevention. Issues discussed in your textbook include focus on the finding ways to prevent male violence, including public awareness campaigns, educational programs, changes in male socialization, better clinical screening of offenders, better training of treatment personnel, better police procedure and specialized prosecutor units are being evaluated. Early identification of personality disorders followed by treatment would be beneficial. Treatment for female-to-male intimate partner violence perpetrators. Issues discussed in your textbook include treatment programs should take into consideration gender distinctiveness. Practitioners should also screen routinely for female-male intimate partner violence. Female offender programs focus on contextualizing women's violence is essential for treatment effectiveness. Treatment focuses on mediator variables that intervene between excessive drinking and female aggression. Cross-cultural practice, policy, and prevention. Issues discussed in your textbook include male-to-female IPV is considered a human rights issue. Legal reforms are needed in many countries. Cross-cultural family violence is a health problem. Not addressing family violence is economically costly. Victims need more resources and options for safety, such as shelters and health clinics. Some suggestions for practice in specific countries discussed in your textbook. For Africa, healthcare professionals need to be more supportive of battered women and screen for violence. Iran, some gender awareness is taking place. Israel, insight therapy is useful in increasing the awareness of attitudes of acceptability of violence. In the Middle East, addressing poverty will do a great deal in reducing violence. Policies are needed across the world to address gender-biased beliefs and attitudes that support violence against women. Strategies that promote equity between men and women, economic opportunities, and increase rights for women, as well as effort to reach out to men and change societal beliefs and attitudes are required. Practice, policy, prevention among immigrant, ethnic, and racial groups. Topics discussed in your textbook include cultural competence is critical for service providers working with immigrant, ethnic, and racial groups. Studies show increased program completion when services are provided in the client's language. Policies that reach out and adapt treatment standard to groups of immigrant, ethnic, or racial minority women need to expand. The focus of prevention that is most needed is challenging cultural norms that encourage violence against women and promoting women's empowerment. Practice, policy, and prevention among rural battered women. Issues discussed in your textbook include practitioners working with rural battered women need to understand the culture of rural America. Policies that speak to access to services and shelters, confidentiality, and better responses from medical personnel and law enforcement are needed. Prevention services to rural battered women need to confront accessibility of pornography to teenage boys and adult men, adult alcohol consumption, and adherence to familiar patriarchy. Practice, policy, and prevention for same-sex intimate partner violence. Issues discussed in your textbook include therapists working with clients experiencing same-sex IPV need to be familiar with gay-friendly resources and try to increase victim empowerment. Lesbians may experience difficulties feeling safe in ordinary domestic violence environments because access is easier for female batterers because of being same-sex. Prevention with lesbian communities should focus on serial abusers, changing the heterosexual attitude towards this group, revising legal protections, having neutrally worded statutes, and giving access to protective orders. Practice, policy, prevention in the military. Issues discussed in your textbook include there are particular issues that practitioners need to address when working with military personnel: treatment of PTSD, treatment of women and children sexual assault and or mixed military sexual assault, and alcohol and other drug treatments. Effective prevention services in the military include training volunteer victim advocates on how to respond to victim of physical or severe verbal IPV on the scene. That concludes this narrated version of this PowerPoint presentation.